Hey everybody, welcome to Menopause Chicks Mondays. Today is a mashup, actually. We're doing Menopause Chicks Mondays live and a special live recording of Live Your Best Midlife webcast and podcast. And I have a very special guest, my friend, and hopefully you are starting to recognize her now, Dr. Kara Dionisio. Hi, Dr. Kara.
Hi, Shirley. Thanks so much for having me on. I've been excited all day to join you tonight.
Well, you are one of my favorite docs. I love chatting with you, and we've got a really, I think, unique and special conversation planned for you today. If you are joining us in the Facebook community or on the Facebook page or on YouTube, I do want you to pop your questions into the comments section, but I do want to note that because we are broadcasting this outside of the Menopause Chicks private community, that I won't be calling you by name. In fact, on the platform that we're using, I can't even see your name. So that's a little bit different than what we normally do, but it's just a way of keeping everyone's questions and comments private. And with that, I'd love to get started. So for those of you that don't know, Dr. Kara, you live in Owen Sound, Ontario.
I do. We have common roots.
Which is about 20, 25 minutes from where I grew up. And actually, you take care of a few people that I really love and who are near and dear to my heart. So I want to thank you for that and for your passion for women's health, of course. So we're going to talk. You just built a new house recently.
Just built a new house, moved in right before COVID hit.
Oh, wow. Congratulations.
Yes, thank you. We love it.
So we were chatting before we went live today. A house is something, I mean, it's a huge asset. Building a new house takes a lot of care, takes a lot of tradespeople, takes a lot of planning. And then I was thinking about the house that I grew up in Wyerton, Ontario. And I was thinking about, well, what were all the things that were, that we learned growing up about being a homeowner. And like one of the things was, always take care of the roof. Like you never want to get a leaky roof, right? Because that would be a big expense, big inconvenience. And then I was thinking, oh, right, mom and dad, they had an oil furnace. And that was something, you never wanted to wake up in the middle of the night and realize that you had run out of oil for the furnace. So there was just this culture that I grew up in of taking care of your assets, taking care of your biggest assets, whether that's, if you're a homeowner, pop into the comments if you're a homeowner and you consider your house your biggest asset, or maybe it's your car at this point. But what else should we be thinking about and maybe using that philosophy, Dr. Kara? I want to hear your thoughts.
Well, it's interesting when you mentioned a roof. Like before we lived in this house, we lived in an older house. And like you, the house I grew up in it was built in the 1800s, like a Georgian, Georgian home, right? And in our last house, we had to replace the roof. And that's not fun, right? Like it's this huge expense, like a lot of money. And, you don't even see it. It's over top of you. I would much rather spend it on new flooring or, appliances or like those shiny, bright things that are inside. But, you do that because, you need, like, that's the solid, well, it's not the foundation, it's the roof, but it's, those are the solid key components of a house. And so health, I think, is like that. Some things are shiny and bright, like maybe the newest supplement or the newest diet or, medication. And those are important. But they're quick. Sometimes they're quick, sometimes they're a little bit quicker solutions. And those are great. We're so lucky to have that many options, but we can't, those don't work as well. And sometimes those aren't the best long-term approach. You've got to work on those health foundations, like the roof and like the literal foundations of your health. And, there's lots of pillars or ways that we describe what those are, but, the main ones are our lifestyle, our diet, movement, exercise, connection, laughter, sleep. Those are like the bases of of health and really being human.
Yeah. Yeah. So, we think about, the assets like our car and our house. But then when you do transfer that over to health, we inherited this philosophy that, we go to the doctor when something ails us.
Mm-hmm.
Right. So I'm curious, what percentage of your patients show up in your office and say, Dr. Kara, I feel like $1,000,000. I've never felt better. But I want to establish a plan for the next 30, 40, 50 years.
Well, more because of menopause chicks. Like, no, I'm not just sucking up here. Honestly, I am not. I'll get on my intake forms. I'm in this group called Menopause Chicks, and I want to come in, get an overview of where my health is, get some good baseline levels, see where there might be problems coming up. And I want to get to know you so that as I transition through menopause, I have a team member. And so that's all on you, Shirley.
Holy cow, that is beautiful.
And it sounds like I'm sucking up. I really know that, but I'm not. And so I am seeing more and more of that. But traditionally, no. And certainly a big part of I get the complex cases often, which I love as a geek at heart. When I have the cases where they say, Kara, you're my last resort. Kara, no one else is helping me or no one else is listening to me. Those patients are near and dear to my heart, but gold star for those ones who come in and say, let's make a plan. Let's see where we are and let's see where this takes us.
That's fascinating to me, actually, because I was just looking up at my wall before we started, 123,265 questions last year. And I can tell you that they were all from women who were experiencing something that was wreaking havoc on the quality of their life.
Yeah.
So back to the house, it was, I think I have a small leak in my roof and I want to do something about it, all the way through to other cases of the floors are flooded, the water's coming in, I'm overwhelmed and I've got no one to turn to.
For sure.
Yeah. And yesterday, I was reminded of this quote. It's a Desmond Tutu quote about, we need to stop just pulling people out of the river. What if we can go upstream and prevent them from falling in?
Yes, upstream medicine is where it's at. And and it's really important right now. And I think that's who I'm seeing right now. Unfortunately, the conventional medical system is so overstressed. Yeah. Everyone's stressed. Wait times. I think I had a patient whose gynecologist appointment had been canceled like 5 or 6 times. And then by the time she saw the gynecologist, the surgery is not for a year out. I think on average for a hysterectomy or prolapse repair, it takes about 100 days to see the specialist and then another 200 for the actual surgery after that. So that's women waiting a whole year. And not every time could that have been prevented. There's lots of times when I say to a woman, you've done all the right things. This is just something about you, and this surgery is the best option. Right. But what if on a group level, we had more patients being proactive and understanding their pelvic health, understanding their hormones, and maybe we can start catching people before the roof's leaking.
Yeah. Yeah. And sometimes I get like really emotional and sad about some of those particular cases because, you and I will hear from the women directly. And then there's other times when I'm feeling really optimistic because I think, well, for my daughter's generation, for your daughter's generation, there is going to be a shift towards that planning and pre-planning. We've done it. Already for RSPs, right? For retirement saving. Like there isn't a person that I know that doesn't know about investing in RSPs. And there used to be, and I think there is still to a large extent, a big push for, you must save for your children's education and you start as soon as you're pregnant, right? And it's, it's just this common, and maybe it's because, there's a lot of big brand advertising that's behind those initiatives. And we really don't have
Possibly.
the big brand budgets that are pushing for women's midlife health. But I think hopefully with some of these conversations, we're starting to move the dial.
We are. And I think even in dialogue, and I actually really love social media in many ways because,
Yeah, me too.
as women, we have this high capacity to take it on, right? We have this high capacity to do amazing things in this world. And like, I can hold all the balls in the air, right? Like,
Yeah.
I have a high capacity. Every mom, woman, whatever it is you're doing in life can do all the things. And, I'm fine. We're good. I'm fine. I'm busy, but I'm fine. And well, they're only fine until they're not fine. And then they're really not fine. And I do see a shift in the conversation about, honoring yourself and honoring, that you are important first before you're helping everybody else. And so that change is here. It's coming. It's harder to listen to it, but it's coming.
Yeah. I want to get really specific for those listeners that might not have an example of what we're talking about. So how, first of all, I wanted to ask you the question of how does one go about making a plan for her midlife health and beyond? And then some specifics, one that I've encountered, when we talk about menopause, often hot flashes come up. It's a very common experience. But the notion and the conversation that surrounds hot flashes and night sweats can often lead to fans, ice packs, Band-Aid solutions, or even worse, I guess this is something I just have to suck up and put up with. And I work really hard to try to bring women into another way of thinking about that, which is, this is a tap on your shoulder. You can hold all the balls in the air, like you were saying. We can put up with a lot. But what if you felt that hot flash and you thought, oh my gosh, heart health. I need to invest in my heart health. So how do we do that? And what are some of the ways and what are some of the examples?
Yeah. So you need to know what your health is. We can't, I think there's it's a business quote. It says you can't manage what you don't measure. And so
I love that.
And it's applied to business, but I think in the context of your health is, how do you know what to change? How do you know what lifestyle factors are important? How do you know what therapies might potentially be helpful for you, as preventatives or when you do have symptoms? And so I always say to my patients on the first visit, I strongly believe in upfront assessment. So investing in understanding your health right now, right? Whether that's through an hour talking to me, going through your history, understanding what your health is telling you. And really also, like, Life Labs knows when the recs come from me, because, we don't have to do that level all the time. You don't have to spend that every time you go to the lab. But if you can really work with your doctor, ask your doctor to be really thorough and getting those baseline levels before you're not feeling well. So maybe this is early in perimenopause where we can get baseline hormone levels and thyroid levels and lipid panel and blood sugar, because those change through menopause. As the hormones change, those also are changing. And so what is your normal? It's not what your friends is,
right?
It's what yours is, right? And we can also start spotting problems ahead of time. So let's say we're looking at, one of those health measures, and let's say the reference range is 50 to 100, right? You want to catch it. Like, if you weren't doing lab testing, you would not know. Maybe yours is, it's creeping up. Maybe it's at 85. It's okay. It's normal.
Right.
Next year, it's at 90. The next year, it's 93. Oh, we might have a little 2-minute conversation. Oh, you should probably change something. And then it's at 98, 99, and then it's 105. And all of a sudden, you're diagnosed with something. Yeah. Those diagnoses don't usually come out of the blue, whether that's diabetes or heart disease or osteoporosis or even depression. Those are not things that all of a sudden one day you have. Those are things that we can look at years in advance. So high insulin precedes diabetes years in advance. Thyroid antibodies precede hypothyroidism about 7 to 10 years before hypothyroidism. So there's things we can start to see and get windows of glimpses as to where there might be small leaks so that we can probably prevent it in some cases, or at least mitigate it or be watching it as we move forward.
I love what you said there. I mean, I love that you use the word invest, because we invest in so many other things. So why not invest in learning, right? In the education, the conversation, the information, as you mentioned. I love that you mentioned baseline. That is something that comes up quite a bit in the menopause chicks community is, do I need hormone testing, for example? And sometimes yes, and sometimes no, but I still encourage women to go and get tested for other things, right? Like their ferritin level. Yes. And to have that information and to know it and to have sort of, it sounds rather old school, but have a health binder. Have a place where you
For sure. And this and it's just is not just about the labs, right? It's about the history, it's about the labs, it's about a physical exam if indicated, and it's also about a woman knowing her body. Right. So, and this is preventative too. So, we're both we're both champions of vaginal dryness and taking care of our vulvas and moisturizing our vaginas. And it's interesting because when I have these conversations and I do vulvar exams with women, they don't actually always the level of their symptoms don't always match with what I'm seeing. And so because they've just never, I don't pay attention or I don't look there. But you need to know what normal looks like, right? Vulvar cancer is quite rare, but it's still the 4th most common cause of gynecological cancer. Wow. And that is most common after menopause. And how can you find that or know something's wrong when you don't know what normal looks like for you, which is different, literally different for every woman. And so like this kind of upstream assessment, knowing your health, kind of expands to all of those different ways of looking into it.
So true. What a comment from a listener right now says, we are fine until we are not fine. So true. Yeah. Right? Yeah. What are some other areas? I know like we get questions and I don't know a lot about bone health or osteoporosis, but I know like that's not something that you just, until you break a bone or till your mother or your grandmother falls and breaks, a wrist or a hip or pelvis, like God forbid, right? We don't really think about our bones. We take them for granted. So what are some things that we should be considering now?
So this one is, this one gets me. Okay, hold on. So, last year I consulted for an American osteoporosis program. Oh. And so I coach every week a group of women with osteoporosis and all about hormones and women's health and things like that. And I can tell you those women, most of them were in their 60s, maybe 50s, 60s, some were younger, but most in that age bracket. They wish they had known earlier.
Right. They wish they had known earlier.
They wish they had known earlier because osteoporosis, like a lot of chronic diseases, is a long game. And that long game isn't always fun, right? We need to, when we think of osteoporosis, we think of, maybe diet, taking calcium, vitamin D, lifting, some weight, like heavy things, some exercise. It expands into inflammation and gut health and absorption, and hormones are a huge part there. And when women go through the menopause transition from about 3 years prior, they lose on average 1 to 2% of bone mineral density for up to 10 years. And so by 7 years after menopause, women lose about 10 or up to 20% of their bone density. 20%. So that is a window of immense vulnerability for bone. It happens earlier too that we don't know. So things like amenorrhea, if a woman loses her period for up to 6 months in her life, it dramatically reduces bone density. So we know this. And yet routine screening for osteoporosis in North America is not until the age of 65.
Yeah, I know.
The age of 65, when that window of possibly, in the younger years, achieving peak bone mass with all of those healthy lifestyle nutrient sort of things and movement and exercise. And then through those times of hormone change, particularly menopause, there are some women who are probably at risk for osteoporosis. They don't know it because they're not getting their bone density till the age of 65. And hormone therapy can reduce the risk of hip fracture by 30%. And so even just, I counsel my patients to say, hey, you have these risk factors, A, B, C, and D for osteoporosis. And I can get that list for you, for your listeners, where it's more indicated actually to do a bone density at the age of 50, where hormone therapy, even minute doses of hormone therapy, like the lowest dose patch, can be very protective, reduce fracture, and even when you stop taking it, can help in the long run.
Long term.
And so that's that. I'm glad you brought up that example because I'm quite passionate about it. It irks me, and I think we have. It's I think it's one you can save for a rainy day. You can put it in the back of your head and not worry about it.
Yeah, and I'm going to jump in here and just really try to underscore something for all of us. If you're listening to this live or you're listening to this on the podcast afterwards, so many of the conversations that you may have witnessed in the Menopause Chicks community have an undertone of, oh, I've reached 12 months period free. I'm home free. I've reached menopause. And, I'll be the first one to say that I encourage that you celebrate that, but let's celebrate it by investing in our bone health as an example, as Dr. Kara has just underscored. And, I know I didn't book an appointment with you, Dr. Kara, but I'm 54. I reached menopause at 49. I have been on bioidentical hormone therapy since 48, but I consider that an investment in my bone health. But what are some other things that I would, need to have on my plan or in my health binder?
For bone health in particular, or for just general health promotion and planning through menopause?
Yeah. Yes and yes.
Yes and yes. I think those are, there are the big kind of 4 or 5. So,
okay.
And it's hard to say because, estrogen and hormones are active in every tissue. Right. And so that's where, again, assessing where your risk is and knowing where to kind of put your eggs after they've retired, your retired eggs, in which basket to put your eggs in is important, right? Because your risk, or maybe my risk, I'm half Asian. I have a fine frame. My mom doesn't have a hip fracture yet, but perhaps that's where I need to really invest in being proactive. Whereas another woman, it's perhaps heart disease. Labs are looking a little iffy. Blood pressure's sneaking up, and there's a family history. And that's really what we need to focus on. Or perhaps it's Alzheimer's, or it's mood, or it's our joints and our physical bodies. So it's kind of, I know I'm underlining this point, but really knowing where your risks are, and it's not genetics. I rarely take that as a thing, but it's considered. And we put all of that together. And then the cool part about lifestyle medicine and nutrition and exercise and stress management and sleep is that they treat all of those. It is like you always say, hormones are not a magic bullet. Lifestyle is, right? Lifestyle is our one known magic bullet that will protect and help us for healthy aging. So I'm not sure if that answered your question, but I think it's perhaps gives a good context and ideas for people in order to start planning and learning about what they need to learn about.
And I hope that it gives, women just a next step. It's like, yes, you might be home free from not having your period anymore, but now you have this menu, and maybe hopefully it's before you're thinking about these health buckets beforehand, but
Mm-hmm.
it gives you another menu to say, oh, now this is where I want to put my focus on. And I'm glad that you mentioned genetics too. That comes up quite a bit. Women will be like, oh, you know, my mom this, my mom that. Our generation, first of all, we're the first generation to reach 50 and have 50 more years to plan for. But we're also the generation who has, I'm not going to say that my parents did not have a stressful life, but we carry a lot of stress, and those things are now showing up in rates of heart disease, stroke, dementia, so on, right? So yeah, really having a conversation with your health team, healthcare provider that you can then trust and work as a team, that's going to go a long way too.
Yeah.
Yeah, go ahead.
I was just going to say, I think where women get really overwhelmed, perhaps, is in actually, again, this is such a blessing, but in the options of what to do. Because we have a lot of tools. So we might call them treatments, but there's a lot of tools, right? Whether that's nutrients or herbs or diet changes or exercise or medications or hormones, right? Those are maybe some of the main categories. And if you read posts on Menopause Chicks, you know, you'll have a question and then a whole bunch of different experiences of different women of what worked for them, right? And that's amazing to have that opportunity to see what is available, but it's also very hard to discern what is right for you. Right. Totally. And that is where working with someone who can do that is really helpful. You know, and my patients who invest in that upfront, you know, really deep dive in their health, then you spend less money in the long run because you're not doing therapies you don't need, and you're kind of dialed in and you have the confidence of a plan and why you're doing it. And so there are so many tools, but whatever is right for your friend might not be the one that is going to fit you better. And that's because there's different underlying causes to everything. And so it can be very overwhelming, but and so I just wanted to say that point of you need to figure out what approach is going to be best suited for helping you.
Yeah. And you know, when it's overwhelming when we try to figure it out on our own, right? Like, have you ever sat with a Rubik's Cube all by yourself and just like, you're just not able to solve the puzzle. And then someone comes along who's done it before and they're like, oh, let me show you how to get all red on one side. And they're like, boom, boom, boom. And you just like, oh, wow, that's impressive. Can you help me get there too? And I think that's, you know, some of the thinking that goes along, but too often we do kind of barrow down in our phones or our laptops and try to find the answer ourselves. And if we can connect with health professionals who have the education, the expertise, and the experience, that's going to go a long way. It's going to shorten the time and distance between 2 points. And then you can get on with enjoying the rest of your life.
For sure. And actually to think out of the box of who that is, right?
Yes.
Because there's not a lot of hormone literate and menopause literate health professionals, full stop. And so finding someone's difficult, but it doesn't, you know, ideally you have someone on your team who is knowledgeable in that regard, but it might be, you might have an intuition that all of this is stress. This is, you know, and maybe you're working with, you know, you're a trusted yoga practitioner, or maybe your, you know, body really needs to work with an osteopath first before you move on to step 2, right? So there's always a step right in front of you. And as long as you are learning and making change and getting momentum along the way, it kind of should be fun as well.
Absolutely.
Yeah.
And, you know, there aren't a lot of hormone balance experts, or I like your phrase, hormone literate professionals. But one of the silver linings that I've noticed that's come out of the pandemic, so we're having this conversation on March 15th, 2021. One of the silver linings is that, you know, telehealth and telemedicine, and so you practice in the province of Ontario, anyone can work with a naturopathic doctor anywhere in the province. if that
for
works
the
for
most
both
part.
you and the practitioner,
Yeah,
right?
exactly. Yeah, and so we've been able to get really I mean my practice is about 95% virtual. And I have one in-person physical exam day. Or sometimes I'll have patients, I have patients all over Ontario where we'll be working together with their pelvic health physio, right? And they can do the exam and send it to me and send a clinical note and say, "Hey, Kara, here's what I'm seeing," in order for me to perhaps prescribe something or make further treatment suggestions from there. So there's a lot of innovation possibilities, I think, that are going to come out of COVID.
Wow, that's amazing. I love that.
Yeah.
Love that
Yeah.
story. Such a success. Amazing. Okay, so we have a comment from a listener. She had a hysterectomy at age 31 and she's now 51, so 20 years ago. And she was only on hormone therapy for a short time and is now having a miserable time.
Okay. There's so much
There's
there.
so much there,
I
but
know.
I will,
And
you
that's
know,
where
I
it's
will go.
funny. Just to caveat, whenever I have a question like on a forum and someone's like, "What should I do?" It's so hard because I get so much data in order to make the precise decision that when I have a broad question, it's actually really hard for me to treat. I'm glad she was on hormones for a little bit. Whenever we have early, did she say it was surgical or premature?
Hysterectomy.
Okay, like a full
Yeah,
hysterectomy?
I'm not sure.
Okay, so
Um,
yeah, that
You know what? I would take that, the general swipe at that comment and say what you were saying earlier is that, lifestyle is a magic bullet. Come to the Menopause Chicks community, take a look at the hormone pyramid. It really articulates that, hormone therapy is not the be all and end all, and that there are many ways that we can support our hormone health.
for
Whether you're
sure.
transitioning, whether it was surgical, hysterectomy, whether you're postmenopause, perimenopause, hormones provide literally thousands of jobs in our body, and we take them for granted,
We
right?
do.
Until there's
Yeah.
an imbalance.
And hormone therapy might be precisely what she needs,
Yeah.
but perhaps or perhaps it's not indicated anymore. And you're right. You work on the silver bullet or magic bullet of lifestyle, and you make sure everything else is optimized. You optimize what you can, whether that's the thyroid or the nutrients coming in or the vitamin D levels.
Yeah.
And we don't know what you need until we know, which isn't helpful to her right now. But I hope it perhaps whoever asked that question is inspired to start digging a little deeper.
Yeah. And please circle back with me if you need some help finding a health professional in your area. So, Dr. Kara, I can't believe it's like time has gone so fast.
Wow.
Whenever I speak with you. You have made a conscious effort recently to focus your practice on women's health. If those of you that follow me on Instagram will remember that Dr. Kara went through the certification for NAMS, which is the North American Menopause Society, last year. Tell us about your work and its future and where we can find you.
There's a lot of changes coming for me, and I've had to listen to my own medicine. I had too many balls in the air, and I definitely had a little bit of a crash last year. So I've had to give up some really dear projects to me, a podcast and the consulting I was talking to you about.
Right.
But I need to be here. I have a mission and a job and a calling, really. I do have a gift for helping women and their health, and it's what lights me up, but I can't do it when I'm tired either.
Right.
Or when I'm stressed and my hormones are all out of whack. So I'm here. That is my work. And I do see patients all over Ontario. And if there's any healthcare practitioners listening, I challenge you to do the North American Menopause Society certification exam. It was a fantastic experience for me. You might not agree with everything. I certainly don't, but you will come away with such a confidence and solid understanding of the physiology and treatment approaches that are possible from a more conventional lens. But so that's my challenge to any healthcare professionals listening.
That's really great to hear. And we need more naturopathic doctors on that list too,
Yeah.
right?
Yes, for
Very,
sure.
very cool. And so your website is?
I'm at healthsquad.ca. That's my clinic here, or drkaraND.ca. But I'm most active on Instagram, which is at drkaraND, Kara with a K.
Awesome. Awesome. I just want to say thank you so much for the support that you provide to the Menopause Chicks community. I really appreciate it. I know all of our listeners really appreciate it. Thank you for taking the time to join us today.
Thank you for doing the inspiring, awesome job of being an ambassador for women. You really are. And I look up to you and just love what you bring to your work.
Thank you. And go make a health plan with your health team.
Yes.
Okay. Have a good
All right.
night.
Bye, everybody.
Bye.